Welcome to this Clinic Conversation of the Week, a series where we discuss the latest groundbreaking research with our patients in the clinic. My name is Brad McGregor, and I'm a medical oncologist from Dana-Farber Cancer Institute in Boston, Massachusetts. And today I'll be discussing ongoing research exploring neoantigen therapy in kidney cancer, how to explain it to patients in the clinic. There was some really exciting data published in the past couple of weeks looking at this idea of a personalized neoantigen therapy or vaccine. So, the idea of using vaccines to treat cancer has been around for a while. And in kidney cancer, we've tried using sort of generalized vaccines, and it's really been disappointing results. So I was very fortunate to participate in what was called the NeoVax trial, where what we did is patients who had kidney cancer resected and had pretty aggressive disease, was stage 3 or higher. What we did is we took their tumors and we analyzed them and we made a personalized vaccine. So it was a protein-based vaccine. And so we gave this vaccine alone without any IV treatment to our patients over a period of time after surgery. And we published results. And of the first 9 patients with over a couple years of follow-up, none of the patients had their cancer come back. And the primary endpoint was really looking at how did the blood get affected. And so what we saw overall is that we can make a vaccine in all these patients. And when we looked at the blood of the patients after the vaccine, the blood showed that they had responded to the vaccine and they were activated against the tumor. So really, really exciting results. The idea that, we can prevent kidney cancer from coming back, not by sort of just taking off the brakes on the immune system, but sort of steering the immune system to where it needs to go through this personalized vaccine. So that was a very complex trial where we had to use protein-based vaccine. It was hard to make, but we now know from our experience with COVID that we can do different approaches, right? And so we have these mRNA approaches where instead of having to make the protein itself, we say, hey, this is what we want the body to go after. We can use an mRNA to give the recipe. And so subsequently, the follow-up study of this, which has just completed accrual, where we gave everyone immunotherapy with pembrolizumab, which is, sort of releases the brakes of the immune system to try to let the immune system go and attack the cancer. At the same time, patients were randomized where we would give them placebo, or we would give them this new vaccine based on their tumor, where we try to give sort of this steer the immune system to go against the kidney cancer. So really, really exciting idea where patients who've had the kidney cancer removed can prevent recurrences, not by just giving immunotherapy to sort of attack the cancer, but trying to say, hey, we're going to give immunotherapy to attack the cancer and really try to drive that immune system into the right space. So I think it's a really exciting way to think about how we treat cancer, specifically kidney cancer, but any other cancer. The idea that as we sort of further explore treatments, not only are we just going to do sort of this generalized activation of the immune system, but using these personalized neoantigen therapies, we can really try to ensure that the immune system is going to go after the specific cancer cells. And so it's really the next step in how we want to treat cancer. And hopefully this is one of many trials that will lead to further improvements for our patients.